Welcome, everyone, and thank you for having us. This is another Charming Conversations brought to you by the Center for HIV and Research in Mental Health at the University of Miami. The Charming Conversations is an initiative started by our Community Advisory Board, and it's a way to have pertinent conversations that are led and engaged, involving our CAB members and faculty and other experts on the topic area. So I'm happy that you're all here tonight. My name is Dr. Sannisha Dale. I am the Director for the Mental Health Disparities Core here at CHARM, and also the Scientific Director for Community Engagement. Welcome, everyone. And I'm going to start off by introducing our panelists, and then we're going to jump right in. Thank you for being with us. Our first panelist here tonight is Dr. Daniel Jimenez, he is a clinical psychologist and an associate professor in the Department of Psychiatry and Behavioral Sciences here at the University of Miami. He has extensive experience in aging research, and he has dedicated his career to improving access and engagement with mental health services among underserved populations. His research areas include geriatric mental health services, health promotion, multicultural mental health, and mental illness prevention. He has received multiple federal grants that involve culturally approaches to preventing mental health in racial and ethnic minority individuals. So thank you for being with us, Dr. Jimenez. Yeah.
Thanks for having me.
Next up, and if I use the word love here a lot tonight, it's okay, because I love a lot of people that I'm looking at right now. So next up is Miss Arnetta Phillips. Miss Arnetta Phillips is a clinical research coordinator in the Department of Psychiatry at the University of Miami. She has worked at the University of Miami for 26 years, fulfilling job functions such as project coordination, assessor, recruitment, and outreach for people living with HIV and people who are at risk. She's a certified addictions counselor for over 22 years and has made significant, I highlight the word significant because she's impacted my career here thoroughly as well, contributions through her work in maternal addiction program and in relapse prevention programs. She's especially passionate about working with women living with HIV, and she believes that her life's purpose is to give back, encourage, and instill hope, and share her story with others. She aspires to and continue to reach and educate and inspire women who are living with HIV and substance use. Next up, thanks for being here, Ms. A. Next up is Ms. Roxana Bolden. Again, love, love, love. Roxana is a member of our CAB here at CHARM, so she's representing the CAB tonight. She is originally from St. Thomas, the USVI. She's a creator of a Sister with a Testimony ministry, which is a ministry that she has that's really about supporting individuals who are unstably housed in Miami local communities, and she goes out and provide different resources and supplies. She's also a community consultant for My Shine research program, and someone who's a fierce advocate, very passionate about empowering individuals impacted by substance use and living with HIV, and just a phenomenal, phenomenal person. So thanks for being with us, Roxana.
Welcome.
Yes. And next up is Cynthia Mitchell. Hi, Cynthia. So good to see your face, and thanks for doing this. Again, a lot of love. Cynthia is someone who has worked as a receptionist in the company here in Florida. She is someone who is living with HIV and is very active in the Positive People's Network. She's very passionate about her advocacy and speaking about topics that impact her, impact the community. She's also a member of several CABs, including the Max Wise CAB, and also other CABs, including a national CAB centered around people living with HIV. Did I miss anything, Cynthia? Nope, okay. So we got a fantastic panel here, folks, so let's just get into it. The topic tonight is aging with HIV and coping with challenges. And so I first want to start off by definition. When you each hear the word aging, what do you think about? And anyone can start us off. What comes to mind when we think about aging?
Getting old.
Getting old, what does that mean? Getting old.
Well, for me, I think about it as a process that happens over time. And it affects us physically, emotionally, psychologically. It also affects our social well-being as well. And as a person of myself living with HIV for 28 years since I've been diagnosed, and I'm also 74 years old. So I know what it feels like to start to age and my body start to ache, and certain things happen to me that make me realize, girl, you're getting old. It's not got nothing to do with the HIV per se. It has to do with the fact that I'm aging.
And I think, thank you, Missy. And I think that's what Roxana was hinting to when she said getting old in terms of chronologically, physically getting old. But as Ms. A is saying, it impacts so many different things that change over time, be it emotionally, physically, socially, otherwise. Others, what about you, Cynthia, or Dr. Jimenez? When you think about aging, what comes to mind? You're muted, Cynthia. There we go.
Okay, can you hear me now?
Yes, we can.
I have to say, when I think of aging, I don't really think of it as getting older. I think of it as a more of a challenge time in my life. Things that I used to do, I can no longer do. I have aches and pains now. My doctor wants me to be tested for much more stuff now. I was diagnosed in 2001, and I was a spring chicken then. I'm 68 now. And I'm socially, I and a lot of other ladies my age, we are not feeling it. We're trying to be content with just staying at home, but I'm trying to get a bunch of ladies together about my age, and we go out to do movies or go out to eat. But it's more challenging. It's not even about the aging thing. It's just more challenges you have now.
Yeah, so it sounds like you're saying there are challenges in terms of things that mandatory screenings your doctor might want you to go through, or things to check on as one is getting older, but also just being able to do the things that you like or want to do, and how what you want might be different from what your peers want, right? You're like, the spirit's in me, I still want to do this, I still want to do that, and other people are like, it's 6 o'clock, we going home, right? So there might be differences in what you want, right?
That's it.
Yes. Dr. Jimenez, what about you? What comes to mind when you think about aging?
So it's funny because I always saw like aging and getting old as the same, right? And I used to see my grandmother who, and she was the one that impacted me to get into aging research. And I used to see her and like, oh, she's old, right? And then as I started doing research, I'm like, oh wait, she might, she's like, yeah, she was elderly or she was old. And then now my father is old or aging, right? He's in his 70s, and I'm like, but wait, he's very young still. Like, and I still see him as the young man that, like he was my age, 30 years ago, right? And so I'm like, wait, so like this whole notion of aging sort of like is weird to me now, because like I'm trying to manage the sort of like the dissonance that's like, wait, no, my grandmother was old, my father's not old, but yet he's now the age that my grandmother was when I was growing up, and then I'm the age that he was when I at that same time. So it's a weird sort of thing for me to wrap my head around.
And I think the other thing you're getting at there is that everyone is aging to some extent, right? There might be somebody who's 70 and somebody who's 30, but compared to when you were 20, you're aging, right? I can tell you things I could have done that I can't do no more, right? And I'm not considered like, older than a senior citizen, but aging is occurring for everyone, right?
Absolutely.
Yes. What were you going to say, Roxy?
Nothing.
Yeah.
Can I say something?
Go ahead, Ms. A.
They always say, age is just a statement of mind. My mind tell my mind tell me I could do certain things, but my body tell me, no, you can't. That's when I realized, I can't run up them stairs like I used to because my knees hurt. You know what I'm saying? I can't do what I used to do, but my mind tell me I can.
There we
And I
go. There
physically
we
try to
go.
do it. It just
Yes.
don't work.
Yes, that
See,
go
now,
down
I
low to
thought-
that spot don't work. Go ahead.
I thought someone was using that as an excuse, but I see it's real. Because
Mhm.
sitting here listening to you all, I'm the youngest of the crew. I'm 47.
Mhm.
I know I'm getting older because, like Cynthia and Arnetta said, there are things that are happening in my body
Mhm.
makes me know that, hey, listen, I can't jump out of bed like I used to do no more.
Mhm.
It's just things are breaking down.
Or they work differently,
Yeah.
they're still working, but you can't put the same amount of stress on them or have the same expectations, a walk in a couple blocks might have taken you like 5 minutes back in the day, but now you're like, pace myself, so it's about kind of things changing, right? Yeah. Mhm.
Yeah.
Yeah.
Yeah, I have a 9-year-old and a 4-year-old,
Mhm.
and they constantly running around the house, and I just get tired just looking at them, and so I'm like, wow. My mind tells me that I'm still that 20-year-old back, that I'm still in college, and when I talk to my friends, we have a WhatsApp group, and we're
Mhm.
constantly talking to each other, and so the mindset is still like, yeah, I'm still in my 20s, and it's like, wait, no, I can't even keep up with a 9-year-old and a 4-year-old, and so yeah, things are a little bit different now.
Yeah.
Yes. Exactly. Beautiful. I love how, just the word aging brings up so many different points of views and thoughts, right? So to get back at something else, when you think about aging, specifically with living with HIV, what are things that you guys have seen among people you work with, things, be it experiences or not, like what do you think the two put together brings up? So what are some challenges or not when we think about aging in the context of living with HIV?
Can I say something?
Go ahead, Cynthia.
My bone density. I mean, so when I asked my doctor about it, she said, well, what do you want to do? You want to be healthy or ache? And I want to be both. I want to take my medication and not have all the aches and pains coming from the bone, the loss of the bone density, which she says is a side effect of my medication. She's saying that I can't have both, and I'm not all right with that. I want to be healthy and not lose the bone density that I have from the medication. So I'm just not feeling that part because I don't think that's a good answer to me. I'm not satisfied with that answer.
May I say something, Cynthia? My primary care doctor took me off of one of the HIV meds because it did affect my deterioration of my bones. That specifically, she took me off of that. And please believe me, I felt differently. She also took me off of medication that affects the heart because heart disease run in my family. And as we get older, we may have those problems with the heart, as well as diabetes, as well as high blood pressure. Because back in the day, I didn't have an issue with high blood pressure. Now I do. And I'm on medication for that as well right now. So I think the best thing for us living with HIV is not just to, I'm not going to knock the physicians that much.
Say it, Miss A.
But we need to be on top of our own stuff. We need to educate our own self. So you can tell the doctor, I know you got something better than this that you're giving me that I'm suffering right now. Okay. So therefore, I think you don't, we put doctors on the pedestal when they wear these white coats. I ain't knocking nobody with white coats now because all my best friends so wear white coats.
Say it,
They're all
say it.
PhDs. But when it comes to our health care, we need to know we are the persons that's in the power to make the difference, to make the change. Okay. I may be 74 years old, but I don't feel it. Okay. I feel good. And the reason I feel good because she changed some of my medications that made a difference in the way I'm walking, the difference in the way I'm feeling. So I don't ache like that no more like I used to ache. I used to ache all over. I don't anymore. The most I take is an Advil. That's it, because it made a difference really in the medication that you take. You have a voice and you need to talk to her about that, or him, whoever your physician is.
I did change doctors this year.
Okay.
Having her for 13 years. I'm like, my thing was, I started with her and I'm gonna stay with her. We have a relationship. No, we don't have a relationship. And
or the relationship worked for a time, but it ain't working no more, and you need it to work better for you.
It's not. You know, so I changed doctors, and I'm loving the new doctor, even though she's getting me tested for a whole lot of stuff that the other doctor never did. And we're concentrating a new medication.
Yeah.
I think you've had everything done.
I left y'all.
No. So this is powerful. If I was to summarize what you both are bringing up, is like, Cynthia is talking about the fact that some side effects of antiretroviral therapy can be an impact on bone density. And you kind of saying that you felt that, and that's been a part of the challenging for you in terms of getting older and aging. But then both of you just brought up, Miss A talked about the fact that like advocacy has been a big strategy and tool along the way to ensure that in the context of aging, and as your body changes and as you change, you're getting the care that you need and deserve, and that the physicians are meeting you where you're at. And Cynthia, you enacted that. You were like, physician, it's been great, no longer great. Let's move on and get what I need. Right?
Yes.
Change is good.
Yeah. You want to add to that, Roxy?
No, I say change is good because I'm one of those people that will advocate for themselves. If a doctor is not doing what I like, I don't care how good the relationship is, I got to move on because, I know me. And you can't tell me how I'm feeling. And if you don't hear me, then I need to go to someone that's going to hear me.
That's right.
Because I'm serious. It took me a while to become
proactive.
No,
compliant.
Oh, okay.
It took me a while to become compliant. So now that I am, I'm very adherent to my medication. I do what I have to do. I know how to read my labs, did that through educating myself. Groups and asking questions and like this charming conversation is information for me, because as time comes, I need to know what to do, what certain tests that you need to take when you get older, what you need to look for, because I don't deal with high blood pressure. I don't deal with bone density, but I have the gut issue. I have gut issue and I have low blood pressure. And then I have the glaucoma. So it's a lot of things that I have to be aware of, because with HIV, all those things, it attacks my eyes, and I'm not HIV, I have an AIDS diagnosis. So, it's just, I just have to be more aware of things as I get older.
Knowledge, you're saying knowledge, being aware, getting what I need, and making the doctors work for me. Yeah. Dr. Jimenez, when you think about your research in the context of aging, what are kind of some, common struggles, conditions, and issues that you see?
So it's really interesting because when I started my research, it was with older adults, and that was 65 and above. And then I started creeping it back to 60 in order to get the bigger pool, so I can get more people into my research. And then when I started doing work with HIV, with people living with HIV, then I had to move that back to 50, because I learned quickly that what a lot of people experience in their, let's say mid 60s or, early 70s, that was happening 20 years earlier to these folks. And so it was a really eye-opening experience to me in terms of working with this population, because it was a much younger population than I was dealing with. So things like people were still going to work, people still had kids, and not having kids, but they still had kids in the home. Whereas like when I had been used to, we're talking about grandparents, taking care of kids, but that it wasn't like their primary duty. And people were retired. So it was one of those things, like it was an educational experience for me to learn, to see that, what was happening in let's say later life was happening much sooner in this population. But I have a question though. The topic of advocacy is, I find fascinating, because if Ms. Arnetta, what you said is very true, that doctors, physicians, they're put on a pedestal, and so as patients sometimes we feel like they tell us and we do what we do, and then we don't question, we don't and so like how can, and it's something that I struggle when I talk to my patients. Like I try to elicit information from them to get them to talk to me, but like what are some things that I can tell my patients so that they can, I'm not a physician, I'm a psychologist, but I hear it from like, well, we got into the office and then they don't ask any questions. So like, how can, what are things that I can tell them so that they can, take it with them so that they can stand up and advocate for themselves?
I have a lot of my participants, as well as, because I work in research with HIV, a lot of them have that white coat syndrome. They look up at that white coat as being a person who knows everything and they don't question nothing. So I try to empower my participants to, if you're too nervous at the time you go in for your appointment, write notes to yourself. So when you do have your appointment, you can bring up those things that have been troubling you all along, because you have a tendency, once you've been in that waiting room waiting for a while to see the doctor, and then freezing in that hallway, you'll forget some of those things. And then these doctors are in and out. You're lucky if you get 15 minutes with them. Okay, so you need to be able to be prepared to have your questions or concerns written down in notes so you can bring it up, and see, I try to empower them that, look, there's no right and wrong. It's no right or wrong. No matter what your question is, it's not no right or wrong. You need to know what's going on, why you feel the way that you feel, why you having these side effects. What maybe this medication is not the right medication. So as a person living with HIV, and other men and women living with HIV who's been with this for a while, if we can empower the younger people, to be able to ask questions, but also got to look at it this way. Older people also have issues in speaking up and talking as well. They really do. They really do. Can I get real now with you? Can I get real? A lot of times they have okay, don't get upset, okay, because you're a little lighter than me.
No apologies for your voice.
You're a little lighter than me, okay? So so sometimes they be intimidated to ask someone who's not of color, who might be white. They don't have that that comfortability, where they feel, I can, if it's another person who's Black, that they can relate to, and that person can relate to them. You feel what I'm saying? So they may have some issues with that. So I think that the physicians need to be able to not just empower their patients or clients, but to let them know that I'm here for you. Because normally when you go there to see your doctor, they ask you, why are you here today? Why am I here today? What's going on with you? You have to tell them what's going on with you, So if you don't have little notes or whatever to tell them what's going on with you, they're diagnosing you or what you're telling them, really. And I'm serious, they're quick to write prescriptions, quick for more drugs and more drugs. And that's not what we need, because we need to be aware of the interaction of certain drugs that not be good for that person. Okay, I'm very fortunate. My doctor is an African-American doctor who I've known for over 28 years. Okay, and she's number one, Dr. Deborah Holmes. She worked at Jackson North, and she's really a person who's really on top. She knows you by your first name. She knows your family. She did a family tree on me, so she'll know the history of my family. So anything she feels that could affect me physically, health-wise. That's why I have to go to see a heart specialist every 6 months or so. That's why I have to check on, I just had a brain scan as well, a whole body scan, a kidney scan, because not only that, because of diabetes, because also I had family members that had kidney failure, so she knows all these things. So she's aware that these are the things that I need to be cautious about. That's what I love about her. So we need to be able to build a relationship with our physicians. And it's not just a physician responsibility, it's the patient's responsibility to try to build that relationship. Even though Roxy, Cynthia said Cynthia had a good relationship with their physician, but they wasn't being heard. They wasn't being heard. So I think it's really important that we're being heard and that we sit there and listen, because a lot of our people, unfortunately, HIV positive, don't want to hear certain things. We don't want to see those bad lab results. That scares us, but there's certain things we need to do. Like, I don't drink, I don't drug, I don't smoke. All these things are important for us. And I hear other physicians, sometimes they don't, push certain things they need to do to stay healthy. Okay. My doctor told me I need to exercise, and she told me walking from one building to another is not exercising. So, so I said, well, I go from one building to another. She said, that's not exercising. So I need to get me a station. I'm too old to be out there running out there. I don't run, and I ain't gonna be walking too much. It's too hot. So I need to get me a stationary bike at home so I can exercise. So a lot, it depends on the relationship. Back to what I'm trying to say, we need to build a relationship where we're comfortable enough that we could talk to our physicians about whatever issues we may be encountered.
Powerful, powerful. And Ms. A, you touched on a bunch of things, in the last couple minutes. And I think a big part of it you're saying is that it takes two to tango, right?
Yeah.
So a physician is to create a culture and a space where they're inviting the patient to speak with them, to share their concerns, right? Because like you said, sometimes there's a lot of time pressure and the person is in and out. And in that short amount of time, if you have a provider that's just talking at you, you might not be able to find the end, like, wait. Yeah. So it takes both the physician creating that space and environment, and also the client then and the patient then saying, I have come prepared and I know what I need to say to you, right? And that's important. It takes two. And you're saying that you also said that when it comes to building that trust, that sometimes, factors around, be it race or gender or age and different things, it might be LGBTQ status, depending on who the person is, like those things can matter, because for many people, they have been treated differently and less than by, say, white cisgender men throughout their lifetime. And so by that regard, it might be a harder relationship to seal just based on face value, right? But it doesn't automatically buy trust, right? So I could show up and be like, yeah, I'm a Black psychologist, but okay, you Black, now what, right? Show me how you're gonna build this trust and how we're gonna work together. But that certain things can initially break down the barrier for people. So I think you're also speaking about diversity in the workforce could help us, but that we gotta build it.
Also, I remember when I had a younger physician, younger than me, they never asked me if I was sexually active. They never say, well, you need to get tested for HIV because I found out I was positive at 46. But as I got older, when I would go to the doctor, they never asked me about my sexual behavior. You know what I'm saying? And maybe because they felt that when you get a certain age, we don't have sex, but we have sex.
Yeah, exactly.
Okay.
We do have sex. Okay. Oh, I'm serious because I was just talking to a participant just yesterday who's living with HIV, but now they're getting treated for STDs. So what I'm saying is the physician didn't even suggest, well, maybe we need to test you for STDs because that person had chlamydia and gonorrhea. So I'm saying we need to be able to say, are you sexually active? Well, then you need to do these tests.
There we go. There we go. And just to be able to see people as whole human beings, irrespective of what age they are as they age, right? Because what you're saying there is that people are making assumptions that aren't accurate about people as they get older, right? Yes, sexual health is still there. People still are going to have pleasure and take care of business, right? It's going to happen. And just many other things are going to happen as well. So to think of people as entire human beings who are still having life experiences, no matter how old they're getting, right? Yeah. Any thoughts on that, Cynthia? You've been.
Yes. You know what? Okay. When you said, I have 3 things I wanted to say. Hey, so if I get see now, you understand. One is,
You got this. Go ahead.
right. When I first was diagnosed, I was in denial. So when I came back in 2009, I was diagnosed with AIDS. And I thought because my doctor took me from AIDS to undetectable, you know, I should just stay there with her, you know. So it was like, well, she did get me to undetectable, and I was like, that was a milestone, even though it took many years. Number 2, I noticed that when I was sitting up there in the clinic waiting for her, that the thing everybody was about, see, you taking too long. Don't go in there and talk all day long. You go in there and let her get your script and come on out. So it was like in the lobby, yes, right there at Jackson, where I used to go, ACCE, they would sit there and they would ridicule you if you took too long. Girl, why you just ain't, you sure took you a long time. People have to deal with that while they're waiting.
Yeah.
And 3, she put me on this medication, and I'm like, oh wow, you know, this is good, this one pill. But she forgot to tell me that I couldn't take that pill with that medication with another medication in the morning. So and she's wondering while I'm not getting any better. I went to a seminar they used to have a pretty regular, and the name of the medication was the medication that I was on. You know, and he specified, he said, you cannot take that pill in the morning. You got to take that pill 4 hours. It needs to be at least 4 hours. You know, so when I came to see her, I said, you know, you didn't tell me that I needed to take that pill 4 hours later than the rest of my medication. You see, I was taking everything at one time. Oh, I didn't. And that's when I realized she's not superhuman now, super doctor. In the midst of her ripping and running from patient to patient, she forgot to tell me something that was very, very important. You know, and sometimes, well, I'm getting older now. Sometimes you have to research that stuff for yourself to make sure that this can go with this medicine and that can go with that medicine. I have a new doctor and she's on top of things, you know, and I'm like, wow, I've never been tested for this and I've never been tested for that. Nobody ever asked me had I had the, what is that shot that keep you,
Shingles? No?
Shingles. Nobody ever asked me about that. That's one of the first things she asked me, have you had your shingles shot? I'm like, no, you know, because I didn't, nobody, my other doctor of 13 years had never asked me that. And like I said, I'm 68. I just got this new doctor this year. You know, so some things we need to look into ourselves. And she'll say something. She said, well, you know, there's a new medication. She says, the clean regimen. I love how she talks. She says, but you do know that it'll cause weight gain. So I don't recommend that for you. And I'm like, oh, I'm that big. But you know, I have to listen to what she's saying. There's another regimen that's even better, but you have to eat with it, Cynthia. I say like, and then she let me ask questions. I said, well, like a banana and a slice of bread. She said, no, so many calories. And I'm like, oops, okay, well, I don't know about that medicine. So I'm still
Figuring it out.
Now the medicine I've been on, now that's got me undetectable, it makes me nauseous. All these years I've been feeling nauseous, but I'm like, I'm undetectable. I can deal with that. Well, I'm a little tired of dealing with that. So now I'm considering another regimen. Even though I'm undetectable now, my numbers are high. I don't like feeling nauseous every morning and thinking about maybe I should take this how bad it is. I'm gonna take the medicine, then jump in the shower, and then I won't notice that I'm nauseous. That's where I'm at with it.
There we go.
But you know what? I need to tell you something, Cynthia. You said something that I disagree with. Your doctor prescribed you the medicine, but you took it every day and religiously. That made a difference in you becoming undetectable. It was you that made the difference.
Okay.
Yes. Love that reframing of the language, right?
It's like you don't owe her anything. She did her job.
Yeah, I love everything you guys are saying. So, and to summarize a bit what Cynthia was speaking of, one of the first thing you commented on is that sometimes the experience we have, right, in terms of going into a doctor's office, is not just the doctor themselves, right? It could be other people involved in the care team or other people waiting in the waiting area, right? And what's being said. So you talked about comments that were being said that made you feel like you shouldn't take up a lot of time and space when you went in there, that you needed to be quick because people were falling behind schedule, when in fact, that's not your responsibility, right? Your responsibility is to get in and get care, but that other people may contribute as well to how you feel in going in and speaking up and taking your time, right? And also, just like you said, doing your research, getting information, and recognizing that, doctors are not, you said, she's not superhuman, right? Meaning that in the context of all the stresses they have, running around, doing this, doing that they might forget things, right? And the things that they omit or forget might impact your health. So being able to follow up, ask questions, do your research, but also talking about when issues are there, saying that, hey, like you said, the nausea I used to deal with, but I don't know, doc, we got to talk about that now, or this used to be okay, but not anymore. So ensuring that, again, the theme here is advocacy. One thing I do want to define, as people may be watching is, Cynthia talked about undetectable. What undetectable means is that, for someone living with HIV, if they take their medication every day, the amount of the HIV in someone's blood is so low that it can't be detected by the measurements that's used. And when someone is undetectable, it also means that it's untransmittable, meaning that HIV cannot be transmitted to someone else. So Cynthia was talking about that's kind of like the goalpost, right? Becoming undetectable, being healthy, etc. But you're saying that, okay, we got to undetectable, but there is more to me than being undetectable. And there's more that you need from your doctor than getting you the meds to then you adhere, like Ms. A said, and get undetectable. Like you need more. That's only a part of it, but not all of it.
That's right. Thank you.
Exactly.
Yeah. Any thoughts, Roxy?
No, you said a mouthful.
Old school girl.
You did. She said it all. Remember, I'm here getting insight. Because I can't really relate to that, but then I can to a degree,
Because you can, because you weren't adherent for a while.
Yes.
So you weren't adherent, okay?
Yes.
So
yes.
now you realize the importance of being adherent.
Yes.
And the benefits of being adherent.
And especially advocating for yourself.
That's
Not
right.
with the doctors. I mean, I Arnetta, you gave me most of the tools that I have, the note taking, Googling, asking questions, being friends with the nurse. You gotta build relationships. So if one person ain't available, you got this other person. So hey, listen, I'm doing this and look at this. I don't understand. What's this? Because some of that stuff you don't understand. and you Google it, you still don't understand.
Mhm,
Somebody that can break it down to my
That's
level.
true.
mhm, mhm,
Like, hey, I'm all right. Like, I still don't understand. I be like, what?
mhm.
Make me understand, because I'm not moving till I do.
There we go, getting what you need. And I
Yeah.
think with everything that you're all saying, you're all talking about that nothing is stagnant, right? So aging is not stagnant, we're changing over time, but nothing is stagnant. Like you were talking about medication adherence, that changes for people over time, right? Some people
Yes.
struggle with it in the beginning,
Mhm.
and improve over time, and some people have dips in the middle because you get fatigued, right? So it's an ongoing process, and people have to figure out what helps them get the support they need, right? Because you're central, like Miss A was saying, you're central to that equation of keeping yourself healthy. Your providers can help get you the tools and help provide information, but at the end of the day, the power is within that individual to take care of their health, right? Barriers might need to be broken down like a lot of other things we know, but the power is there to really hold on and take care of themselves if they get access to the tools they need.
Yeah, that's what I was trying to say right there.
No, you said it. So let's talk about, so you guys are talking about some of the coping already. So you've talked about some of the challenges, in terms of like providers, some of the different conditions that people might experience, just typically aging, right? Thinking about side effects and other things. What have been ways that you each have either coped or seen other people cope as they age that have been useful? And I guess I'll start off with Dr. Jimenez on this. In any of the research that you do, do you explore or get a sense of what strategies are helpful for people as they age and as things change for them?
So one of the things that I really find fascinating about aging is that it's not like exactly what you said, Sannisha, like nothing is stagnant, right? And so everything constantly changes.
Mm-hmm.
And then there's this notion that we feel or that we think about that, like, oh, when you retire, then it's almost as if like that's it, right? Like nothing changes. Everything is, you're old, you're retired, and then that's it, right?
Mm-hmm.
And so what people often don't realize is that, things are constantly changing even when you retire. And when you retire is a big deal because work provides structure. So as you get older, right, the work is great because it pays the bills, but also it gives you structure. It organizes your day, it gives you purpose to get out of bed. And when you retire, all that goes away. And so what I have found is in both the clinic and both my clinic and in my research is one of the things that people really struggle with is that, like, I'm no longer working, so I'm no longer, whatever that was, right? Like I'm no longer an employee. So then what do I do with my day? What do I do? Like there's like this disorganization, and so they're sort of like aimless. And so one of the things that I really work on, and I'm a big behaviorist in the realm of psychology, I'm a big behaviorist because for me, it's the easiest way to intervene. And it's not only the easiest, but it's the one that people see the most change in, right? Because if you go from not moving to moving, that's objective, right? Like you can see that. And so one of the things that I always encourage people to do is to really make a schedule for yourself. Like if it's, even if it's like putting down, eating breakfast and, reading the newspaper or, just, but at least having a day where you see that everything is organized and the things that you have to do and may not want to do, like cleaning the house or something, paying the bills or making these phone calls, but you mix that in with things that you do like to do. And it gives that day like, oh, what did you do? Well, you could see exactly what you did. And so it just becomes very, so that's why that's one thing that I always encourage people to do. Number one is to organize, get yourself as organized as you can. But second is to be active. And now I'm not asking people to run a marathon, but you know, get out of the house, go for a walk, go for a swim, you know, whatever it is that you do, but at least get out of the house so that you can at least get some vitamin D from the sun, you get some fresh air, change your environment, because if you're staying home, like these walls start closing in on you real quick. And so those are the two things that I always really encourage my patients, both in the clinic and in my research, to do, is to organize, make your schedule, and I tell them to put in everything in there. Like, no matter how silly it is, it's like, oh, I'm going to do a crossword puzzle. Put that in. How long is it going to take you? An hour or 2 hours? Doesn't matter. Put it in. And so then so then like, oh, I'm going to do the crossword puzzle today. Yeah. And then you do it. So it builds a routine, right? So that becomes it's a reason to get out of bed and get your body still moving and active, and then put into your schedule, get out of the house, whether it's 20 minutes, 30 minutes, an hour, whatever, but at least you're out of the house. You're getting, you know, you're getting your exercise, you're getting your heart rate going. And those things I have found to be very powerful tools that seem very simple, but you'd be surprised that not a lot of people do it.
I agree with you, because my sister retired too young, and she found herself being bored to death with nothing to do and feeling very lonely. We live together, so I'm still going to work. So she's home all by herself. She's feeling lonely. She's feeling lost. And that's really something, because I worked 10 more years longer than she has. My coming to work was a structure, was good for me. But also I know that what I want to do, because I have planned on joining Silver Slipper and with and go to the gym, and with people my age, we won't be riding the bikes hard, but we might be sitting on that chair doing a little exercise, you know what I'm saying? But you build relationship and you build friendships as well. You know, you're building friendship with people that's understanding what you're going through around your age, where you also manage to do things like, I think Cynthia said, make plans to go out to lunch, do things, even walk together down a park, you know, being active. For me, I love art, so I plan on taking some art classes where I'm actually using my mind and also meeting other people. So it's really important, because she is bored to death. And I was just watching her, and this is a woman with no issues like what I'm going through. So being that I am positive is always important for me to always be motivated. So I need to feel like I have some self-worth, because when you don't feel like you have to have self-worth, you feel like you're nothing. You stop caring. And then next thing you know, you're just laying around in your pajamas on the couch watching TV with the remote. You won't even get up to change the station. You have the remote. That's all you're going to do. And that's not living. That's just existing. You know what I'm saying? Besides getting up and going for a doctor's appointment, that's the only probably activity we do. Go to a doctor's appointment, come back home. So we need to be able to be involved and do more things. Like Cynthia right now, she's gotten involved in more things. She's now going to be in the national cab. I'm in the cab that she's also in. So we're in groups with other people living with HIV. We're going to do a combined cab this time, this Friday, with men and women. So we're going to be able to hear different issues that our men going through as they age as well, in comparison to with the women. So that's really important, being more active, getting involved. And because sitting at home doing nothing is not healthy, mentally or physically, emotionally as well.
A lot of powerful statements there about strategies to use. What about you, Cynthia or Roxy? What strategies are you using? And I guess I also want to, again, remind us, you know, when we're talking about our definition, aging is not just when you've reached retirement age, right? But in the context of how your body is changing and when things are changing. Because Roxy, you said earlier, I ain't up there yet, but guess what? This body is changing and I'm noticing, right? And so how are we coping and what are we doing as things change? Yeah.
Because earlier part of this year, I had to let my job go. To let my job go because of the pain in my body. It became too much. You think, like I said, that's something I've did all my life was cashiering. You know, and once I get it, but just the standing up now, it was too much. A perfect example of what you were talking about, Arnetta. because the first 2 months, I mean, I did not get out of my bed. I was so depressed. Like, what do I do with myself now? But then, boom, hold up. You know, thank God for other outlets, other families that I belong to that I grabbed some tools. And I know idle mind is not good for me. It's not good for me. So I stay busy. And you know, I focused on my ministry. You know, I pick up a GD book every now and then, you know. School not something I'm cool with. I know I need to get that, but I ain't there yet. But I focus on other things, you know, like the ministry. I focused on my mom. I did something motivate my mind. And even though I did all those things, it still wasn't enough. But then again, with the tools that I have, you know, I'm reaching out to counseling because I feel unbalanced. You know, maybe I need to talk to somebody because something else going on. And you know, so that's why it's good to be aware of yourself and, you know, what's going on inside, internal. Go mental, spiritual, it's all entwined. And if something off, it's so.
Yeah, therapy is
There we
good
go.
now. Therapy is good.
Hey.
Amen on therapy.
So, a lot of people I know be like, oh, I ain't going to therapy. I ain't crazy. Listen, if you living on this earth, you need somebody to talk to. It ain't about being crazy. It's about having an outlet.
Yes.
Somebody, they don't know you and you don't know them. They can insight on the situation. They're like, wow, I ain't think of it like that. You know, overreacting for nothing.
There we go. There we go. Love these gems. Cynthia, what about you?
I went back to work.
You went back to work.
Yes, I went back to work. You know, and June 30th of this year, I'm very happy with it. I'm outside, I meet other people. When I was at home, all I was a taxi cab driver, sitting around waiting for people to get their nails done.
You was an Uber for free, huh?
I get on Facebook, you know. So a lot of people are very unhappy now, but I'm happy. You know, I'm fulfilling my own needs. I've learned so much on the computer. When he told me to do an email, I'm like, oh my God, email on the computer. Oh, I just love it. I've learned so much, you know, and we have stairs, 23. And I have to walk up those stairs Mondays, Wednesday, and Thursday. So I get my exercise. When mail needs to go out, I have to walk around the corner to the post office. All that is good for me. I'm all right with it, you know. So, and I get a little piece of paycheck. I got a RP, you know. So I'm a receptionist, so I spend a lot of time sitting down. But I make sure that I get my exercise, going to the mailbox, going to the post office, going up and down the stairs. And I know he was surprised today, my boss, because he sent me downstairs twice. He said, I hope you don't get angry because I meant for you to take this down. And I'm like, no, I'm not gonna get angry. Hey, that's just more work to wear some of this off, you know?
Yes.
Yes. I'm excited about it. You ought to see me. I get my clothes out the night before, and my son say, "Mama, I know young women that don't go to work." I'm like, "See, he's proud of me."
You're motivated. Motivated.
Yeah.
When I went back to work, Ms. A.
Yes, I know. I'm gonna tell you something. Whether we realize it or not, as we tend to mature. We are really the type of people that can be very dependable when it comes to a job, because we appreciate going to work and making a paycheck. Okay,
Yeah.
We're not going to be calling in late because we stayed out partying the night before.
I open the door.
We're not going to be doing that because we ain't going to be partying. Okay, we're going to be on time.
Arnetta, you're telling the truth.
And we want to get that check on time.
It's been 6 months since I left that job. And every time I talk to my supervisor, she's like, you sure you don't want to come back? No, it'll
Oh.
never be another Roxy there.
Y'all are amazing. So, if I was to sum up some of the pieces I'm hearing here, is that there are many ways that people are coping. But the main crux of all of it is, to stay active, right? To stay doing things that you enjoy, that build you up, right? And those things could include exercise. It could include being in communication with people that you care about, getting involved in advocacy, right? It could be your job and work. It could be seeking out a therapist to talk to, right? And it could be getting the medical care that you need to better enhance how you feel, be it addressing pain or aches or side effects or other things. But the point is that there are many different ways to cope with the aging process, but you have to do something and get those tools and figure out which ones are going to work for you personally, right?
And I would like to add, like, it's a lot of trial and error too, right? Like, and just because you try something, you're like, oh, I didn't like that. Like, okay, then find something new. Like,
Yeah.
But we tend to like, oh no, I tried this and that didn't work because I didn't like it. Like, like, oh, I tried knitting and that I didn't like it. I didn't take to it, and so then I don't know what else to do. You're like, there's a million other things to do. It's all about finding out what it is that you like to do. And it's a mission and it's a mission to find out what it is that you like.
There we go. And that it's different for everybody in terms of what will work for them. And to go back to something Miss A said earlier, she said, we have to live, not just exist. So just find things that bring you meaning and keep you going. But really powerful points. The last thing I'm going to ask of you all is to, if you were sitting across from someone who is aging, and aging with HIV, and they're going through challenges, what are some words of encouragement that you would leave with them?
I'd like to say something. Okay, number one, therapy is good. I have a therapy that I attend a group on Mondays on my phone because I don't think it's nobody business what I'm doing. I can't exactly do a lunch hour. I come in at 9, at 11. It wouldn't be right to be there 2 hours and then disappear for 30 minutes. But what I try to encourage my sisters, a lot of things that we go through or that they're going through is because of other people. We allow other people to infringe on us. It has to come a time in our life where we have to say, hold up, I'm the most important person here. Hey. I'm not the babysitter. I'm a grandmother, yes, but I'm a grandmother when I choose to be. I would keep the grandchild, when I have time, when I'm not doing anything. And another thing I ask, when the last time you've been to the movies? It's nothing wrong with a bunch of us going to the movies together or going to a place where the buffet where we can eat and enjoy each other. Why do we feel like because we got a certain age, I'm just gonna sit down and watch the grandchildren? I don't think so. A lot of those feelings you got is because you're denying yourself, and we forget to put ourselves first. When do we start doing this? When we get 90, and if we make it to 90, when do we start feeling like we are important too? It's not about our children and grandchildren. It's about us. I feel like you ought to see me when I go to work. Honey, I'm clean. I wear a different dress every day. I got a smile on my face. I'm not cluttered down with whatever my children got going on. I love my grandkids and I got great grandkids, but I have to be the most important person.
There we go.
It's about me today, and a lot of us haven't gotten there. I'm working on quite a few of them. If I have to drag them out, pick them up, it's okay. Because I know it's a hard thing to break when you've been set in a way so long. It's kind of hard to change.
Love that. Put yourself first. Number one. Yes.
I was talking to one of my participants just yesterday, and the whole time I was assessing her, all she did was cry. cry because she was getting older. Because my study is looking at men and women between the age of 30 to 70, and the average age of most of my participants was 50, 60, like that. So she's crying because number one, she didn't lost her mother, she didn't lost friends, she lost friends, especially for me personally, have lost so many people that I got close to over the years who have died for complications due to HIV. That in itself can be very devastating, because then I didn't want to admit it, but sometimes I put myself, that could be me. You know, that could be me. And you get very depressed because of it. But you know something? My mom died, my father died, all three of my sisters and practically all my aunts and uncles, because I'm 74, so they would have been much older. But you know something? In their death gave me strength, and it gave me hope, because they built that foundation in me as a child to have that spiritual feeling and the belief that I can do all things with God who strengthened me. I feel good of who the person I have become. I'm comfortable in my skin. I'm no longer ashamed and afraid, because I went through that whole part of my life of feeling guilt and ashamed because I was HIV positive, because I was afraid what people was going to think about me, because people who used to hug me or touch me when they found out I was positive didn't want to hug me or touch me anymore, because they just was lack of education on how you get infected with HIV. I had to go through that. And those of us living with HIV go through a lot of that stigma. To this day, after 28 years, almost 29 years, I'm still living that stigma, because people are always saying things to make you feel bad. So I'm listening at all that language, as well as getting older, you know, at the same time. But I always say, y'all, I got to go to church. Now, devil's a liar. I'm not going to think or feel that way. I refuse. I refuse. Because when I tell you life is for the living, and I am living it, I'm enjoying it. Okay, but I have a son, but I don't have any grandkids. But when my little nephews and stuff come around, at a certain time, I call my niece and say, come get your children. They got to go. Okay, keep it moving, because I need time for me, you know, because we can't afford to be stressed out unnecessarily, because it's not good for us, our health. You know, we have a lot of things going, but you know what? When I learned a long time ago, I'm also a recovered addict, and I've been clean this over 27 years. When you dwell on something too long, it'll make you sick. So I learned to rechannel those thoughts in a positive way that makes me feel good. Because every time I think about how I was, when I first found out I was positive, I was in denial for a whole year, okay? And then, because I just didn't want to deal with it. I'm 46 years old, what I'm doing being positive. The lack of education, thinking, oh, only gay and bisexual men get HIV positive. Only people just running the streets get HIV. No, sweetheart. HIV has no stigma to it. Everybody is subject to it. Everybody, okay? So you around here talking, when is the last time you can test it? Okay. So I'm all right with saying something like that. So I think it's because I went to therapy. That's why I say amen on therapy. Therapy helped me to accept the things I could not change, and the courage to change the things that I can, and the wisdom to know the difference. Yes, indeed.
Yes.
And I just have to say this. Maya Angelou said, I wrote this down. You may not control all the events that happens to you, but you can decide not to be reduced by them. And I love that statement.
Yes. A lot of powerful parting words. Roxy, what will you say in terms of words of encouragement for someone?
Stay true to yourself. You know, life is easy, and we get dealt certain cards. And you know, I don't have children, and family for me is family for me. You know, I had to learn how to be my own family. I had to learn to build another family, because what I was born into rejected me the most. And it was even before HIV. Things my father did. You know, I dealt with trauma long before HIV. You know how to process it. So when HIV came along, you know, because I was one of those people like Miss Arnetta, not me.
Yeah.
I was sleeping with one person. One person had it. And, you know, it was a secret, you know, the stigma. You know, who gonna want me if I tell it to you?
Yeah.
No. But once you start loving yourself,
There you go. Amen.
because that's what I had to do. I started loving myself. It wasn't no longer my mother's fault, you know, because I kept doing the things to myself. So once I started loving myself and accepting who I am, I was free.
Yeah.
You know, and it took me a long time to be free. With HIV for 26 years. And I wear different hats. I'm a chameleon. I blend in different atmosphere, and certain people can't know this and certain people can't know that. And I can never really be me.
Yeah.
So, you know, be true to yourself. Because at the end of the day, that's all you got.
Absolutely.
Powerful, powerful, powerful.
Thank you, Roxana.
Yes. Dr. Jimenez, any last words of encouragement?
I was gonna say, and Ms. Arnetta sort of, she echoed exactly what, or she said exactly what I was planning on saying, especially at the end, is that things happen in this world that we can't control. A lot of things happen in this world that we can't control, and there's a whole lot more things in this world that we cannot control than the things that we can control. And so we can't control the aging process. We can't control how our bodies sort of go through this. But what we can control is how we react to that and how we sort of mitigate some of the changes that happen in our bodies and in ourselves and in our lives. And so, you know, yeah, if like it makes it really hard to get up in the morning because your knees hurt and, you know, your body aches and pains. And so that just means that you need to do more things in order to allow your body to keep doing what it needs to do. Right. So there's a lot of control that we do have that we don't see. And I think that is, I think focusing on those things that we can control rather than the things that are happening around us that we cannot control. I think I think understanding that and taking that to heart, like not only just understanding it, but actually becoming a belief within yourself, right? Like is a powerful thing.
Yes, yes. And to summarize, just powerful. Oh, I love these charming conversations. But I think what I'm hearing here is a theme around, you know, Cynthia, you said, put yourself first, right? There are many roles that, you know, we've played in our lives, or you played for the people, be it, you know, grandmother, friend, whatever it is, but you have to center yourself and put yourself first, right? Ms. Arnetta, you talked about the same thing in terms of seeing yourself that you are enough. You are good as is, and accepting yourself. And Roxy, the same theme, right? Loving yourself and learning to love yourself and acknowledging that that's a process, but something that you ought to hold on to. And also Dr. Jimenez, in terms of life is rocky, right? There are trials and tribulations and paths, and aging is rocky. We don't know what's gonna come our way, right? This body, it holds on to the best of its ability, right? But it's here with us, but as it starts to struggle, and we are struggling, be it physically, mentally, and otherwise, in terms of losses and changes in our support system and who's there and who's no longer there, that we also have to exercise some acceptance along that journey that life is happening, right? We are still here, and then find all the tools that we can along the way. The words that I would say of encouragement is very much in line with that. It's by Toni Morrison. And she said, you're your best thing, right? And remembering that, like in all of it, you're the best thing that you got, you know, so prize that, take care of yourself, love yourself, you're your best thing. Thank you so much to these amazing panelists. I love you all. I appreciate you taking the time to be here and to have this conversation. Thank you to the audience members who are here on the webinar, who are watching us on Facebook. You know, we appreciate you for being here and listening, and we hope that you take something away. And we will be doing other charming conversations. We do one of these every month. Again, it's brought to you by the Center for HIV and Research and Mental Health here at the University of Miami, by our Community Advisory Board. And we appreciate you all again, and stay, you know, blessed, take care of yourselves, and do all you can to stay safe in this pandemic. But thank you, everyone.